Assalamu alaikum students. Assalamu alaikum. So welcome you all to this one more anatomy lecture where we'll discuss the anatomy as well as some developmental features of the stomach. So today we'll discuss the stomach and its anatomy as well as some of its development part. Okay. So by the end of this lecture, you should be knowing the anatomy of the stomach, including its location, shape, parts, relations, blood supply, as well as nerve supply and lymphatic drainage, as well as you should know the brief development of the stomach. Okay, so these are the two objectives which we will be mainly dealing with in this lecture. Coming to the stomach, so as you know, the stomach is a part of the alimentary tract, the gastrointestinal tract, and this is the most dilated part of the whole of the intestine. Here is the stomach. We have the stomach here. So this is the most dilated part of the alimentary canal or the alimentary tract or the gastrointestinal tract. So if you want to locate this stomach, it will be in the upper part of the abdomen. So this is the upper part of abdomen. This will be called as the lower part. And if you want to locate it exactly in some regions of the 9 quadrants, so it will be present mainly in the epigastric region as well as it will be occupying the umbilical region. These are the two areas where it will mainly occupy the abdomen, in the upper part of the abdomen, in the epigastric as well as umbilical part. Okay. The the stomach is mostly covered and well protected by the lower ribs on the left side. If you see here, this is the costal margin as well as deep inside will be the stomach. So it is well protected by the lower ribs. And if you see the shape of the stomach looks like the English capital letter, the J. It looks like J. Okay. So this is the shape of the stomach. So coming to the parts of the stomach, so it will have two orifices. What do you mean by orifice? Openings. So there will be two openings for the stomach. So one will be on the top. This is called as the cardiac orifice. It's called as cardiac orifice because it is very close to the cardia, the heart. The second opening is where it ends. So cardiac orifice, where it begins, the stomach, the esophagus opens into the stomach, that is the part, and where the stomach ends and continues the duodenum, there is the second orifice opening, that is called as the pyloric orifice. So these are the two orifices. Then it has two borders. One is the greater curvature, this big long curvature border of the stomach, that is the left border of the stomach, is called as the greater curvature, or it is also called as the left border of the stomach. Then we have the right border of the stomach. This is called as lesser curvature. These are called as greater and lesser depending on the size. If you see, the lesser curvature is short, so it is called as lesser, and the greater curvature is very long, so it is called as greater, and it is curved. It is not straight, but it is curved. That's why it is called as curvature. Greater curvature as well as the lesser curvature, or the left border and the right border of the stomach. Now coming to the two surfaces. So there are two orifices, two borders, and two surfaces. Which are the surfaces? The surface which you are seeing right now, this is the anterior surface. Anterior surface. Then we have the behind will be the posterior surface. Behind will be the posterior surface. So two orifices, cardiac as well as the pyloric orifice, two borders, the lesser curvature and greater curvature, and two surfaces, anterior surface and behind will be the posterior surface. Now coming to the three parts, it has three parts. Which are those? One is the top part. This is called as the fundus. This is the fundus. Then we have the body, the big large part. This is called as the body, where the actual digestion will be taking place. Then we have the pylorus. This is the pylorus. Okay. So the pylorus is again divided into three parts. So the first part is called as the antrum. This is called as antrum. It is also called as pyloric antrum because it belongs to the pylorus. So it is called a pyloric antrum or antrum. The second is a narrow part. This is called as the pyloric canal. Pyloric canal. Before it opens into the duodenum, it becomes a long tube. Then it is called as pyloric canal. Then, before it opens, there is a sphincter-like structure where the muzzle of the this pylorus part becomes narrow, and it acts like a sphincter to allow the food particles in a successive manner. So that is called as the pyloric sphincter. So it has three parts. The pylorus has three parts. First, the stomach has the three parts: fundus, body, and the pylorus. And the pylorus itself has three parts: pyloric antrum, pyloric canal, as well as the sphincter. Okay, which allow the food particles into the duodenum. So these are the three parts of the pylorus. Now coming to each parts one by one. The first is the cardiac orifice. Cardiac orifice. Okay. So here we can see here. So this is called as the cardiac orifice. It is a site of gastroesophageal sphincter. So it is the area where the esophagus opened into the stomach, and that part is slightly narrow compared to the other parts. It is called as the gastroesophageal sphincter, where the sphincter is present. This is called as the cardiac orifice. If you see the sphincter, actually you cannot see actually anatomically. So it is more a physiological sphincter rather than an anatomical sphincter. For anatomical sphincter, it should be prominent, but if you see here, you cannot see it much. Okay, but when it acts, it will contract. This part will become narrow. Okay, so during the physiological action, whenever the vagi are stimulated, then it becomes narrow. Okay, so that's why it is more physiological than anatomical. Means anatomically you cannot see, trace it. So why this happens? Because of the circular layout, the smooth muscle. There are two types of muscle, as you know. The wall of the all the part of the GIT will have, most of the parts of the GIT will have the inner circular and outer longitudinal smooth muscle fibers. The inner circular smooth muscle fibers here, they contract by the stimulation of the vagus nerve as well as some of the hormones. So that's why it will act physiological and it becomes, this part becomes narrow. So what is the main function of the sphincter or the orifice? The sphincter mainly prevents the esophageal reflex, or it is also called as the regurgitation of the food particles. When you swallow it, normally if the sphincter is normal, if the gastroesophageal sphincter is normal, then the food shouldn't regurgitate back, okay, into the esophagus. So it prevents, this sphincter prevents esophageal reflex. So if this sphincter is damaged, then there might be regurgitation. Okay. Now coming to the next part, the fundus. So the fundus is the dome-shaped structure which is above the opening of the cardiac orifice, just above the opening of the cardiac. If you draw a line from here, this is called as the cardiac notch. So at the cardiac notch, if you draw a horizontal line, then whatever is above that, that is called as the fundus. It is dome-shaped. It is dome-shaped structure located to the left of the cardiac orifice. As I said, it is on the left side of the cardiac orifice, okay, and above it. Usually it is filled with gases. So whenever you take the x-ray, whatever the air which you see just under the diaphragm on the left side will be because of the air in the fundus. So if there is air in the fundus on the below the left diaphragm, then it is normal. If it is present below the right diaphragm, then it is pathology, because there is no space between because on the right side we have the liver directly below the diaphragm, so there shouldn't be any space. So but on the left side, because within this cavity in the fundus there is a space filled with air, so normally on the left side you can see this region as gas under the diaphragm. On the left side it is normal. Okay, so usually because it is filled with gases. It reaches to the left fifth intercostal space, a little below the apex of the heart. If you see the fundus, it will go near up to the topmost portion of the diaphragm, and it will reach almost at the fifth intercostal space. So what is there in the fifth intercostal space? The apex of the heart is present in the fifth intercostal space. So this fundus will be just below that apex, okay, just below the diaphragm. So the apex of the heart will be above the diaphragm and the fundus will be below the diaphragm. Now coming to the body. Body is a large part of the largest part of the stomach. Extends from the level of the fundus, from here from the fundus, okay, up to the level of there is something called as the incisura angularis or angular incisura. Both are same. So what is this incisura angularis? It is nothing but a constant notch on the lesser curvature. This is called as the lesser curvature. So just below that, here between the lesser curvature and the pylorus, there is a constant notch which is always present. This is called as the angular incisure or incisura angular. There are two angles. One is this, the incisura angularis. The second is the cardiac notch. These are the two notches which you can see. Okay. Now coming to the lesser curvature. So we have seen this is the lesser curvature. It forms the right border of the stomach, as I said before, and it is shorter, so that's what is called a lesser curvature because it is curved. And here is the incisura angularis. So it extends from the cardiac orifice up to the pylorus. It extends all the way from the cardiac orifice up to the pylorus. Pylorus is here. So up to pylorus will be the lesser curvature. It is attached to the liver by the lesser omentum, the gastrohepatic ligament. If you see here, there is a ligament extending from the liver up to the stomach. This is called as the lesser omentum. Lesser omentum has two parts. One is called as the hepatogastric, which is between the liver and the gastric means stomach, hepato means liver, between the stomach and the liver. Then there is other part which is called as shorter part, which is called a hepatoduodenal, which extends from the liver to the duodenum. So together these two are called as lesser omentum. Okay. So the lesser omentum is attached to the lesser curvature of the stomach. Now coming to the greater curvature. Now we see this is the greater curvature. So form the left border of the stomach, as we have seen. This is on the left side, so it is called as the left border of the curvature, and it is greater, longer, and it is curved. That's what it's called as greater curvature. So it extends from from the cardiac orifice all the way from here, and it is very long. So that's what is called as greater curvature up to the pylorus. Again, it goes up to the pylorus, from the cardiac orifice up to the pylorus. This is the greater curvature. The upper part is attached to the spleen by the gastrosplenic ligament. If you see here, there is spleen here. So this is the spleen. So there is a ligament between the spleen and the greater curvature. This is called as gastrosplenic ligament, a very important ligament. Then in the lower part, it is attached to the transverse colon. If you see here below, there is transverse colon all the way running here. So it is attached to a transverse colon by this is called as the greater omentum, which is also called as the policeman of abdomen, filled with huge quantity of fat. Okay, so this is called as the greater omentum. So there is connection between the greater curvature and the transverse colon by this greater curvature, the greater omentum of the stomach. Now coming to the pyloric antrum and the pyloric canal and the pylorus, the whole thing. Okay, so here is the whole pylorus. Okay, so the pyloric antrum extends from the incisura, as we have seen. Incisura was here, so this is the angulation. So the pyloric antrum extends from the incisura to the pylorus or the pyloric canal. Okay, so this is the pyloric canal here, which becomes narrow tube. Till now it was distended. Now, but as before it opens into the duodenum, it becomes a canal-like tube-like structure. So it is called as pyloric antrum. This is dilated, so it is called as pyloric antrum. So the pylorus is tubular part of the stomach. This is, as I said, it is tube-like, just like other parts of the intestine. It lies in the transpyloric plane at the level of L1. So there is a line horizontal. If you remember, before we had discussed the transpyloric plane, it is a horizontal line extending all the way from one side of the abdomen to the other side to divide it into 9 quadrants. Out of the two horizontal lines, this is the upper horizontal line. So this passes through the pylorus. That's why it is called as transpyloric. Trans means through the pylorus. It passes through the pylorus, so it is called as transpyloric plane. And this is at the level of L1. And this pyloric canal is almost 1 centimeters to the right of the midline. So it is slightly away from the midline, almost 1 centimeters. It has thick muscular end called as the pyloric sphincter. Before it opens into the duodenum, this wall, the smooth muscle of the pyloric canal becomes thickened and it becomes narrow. Now if you can see here, it can be clearly seen. So this is an anatomical sphincter. So both it is physiological as well as anatomical. But here there is no sphincter-like thing can be seen. So it is more physiological than anatomical. But here you can see easily. So it is anatomical also. Both physiological and anatomical sphincter. This is called as the pyloric sphincter, where the muscles become thick muscular and it will be always contracted, and only when the food is being pushed into the duodenum it opens. Other time it will be closed. The cavity of the pylorus is the pyloric canal. As I said before, the pylorus part which becomes tube-like, so this will be the cavity will be called as pyloric canal. Now coming to the anterior relations of the stomach. What are the anterior relations? Here is the stomach. As you can see here, this is the stomach, which is seen when the anti-abdominal wall, the ribs have been cut. Okay, so what do you see in the anterior? Anterior will be the anti-abdominal wall, which I said is cut already. The anti-abdominal, here is the anti-abdominal wall. It has been cut in the front so that you can see the stomach. So that will be there in anteriorly, as well as the left costal margins. The left costal margin, here will be the left costal margin. Again, this is cut so that you can see the stomach. Okay. Then the left pleura and the lung, and the diaphragm. Above the diaphragm, there will be here will be the heart, and just beside that, here if you see here, here will be the lung and the pleura. Both will be extending in the front. So left pleura and the lung will be also anterior, as well as you can see here the diaphragm, which is also cut here. So the diaphragm also extends all the way into the front of the stomach, as well as the left lobe of the liver. Even if you see here, this is the liver here. It is so huge that the right lobe of the liver is here, but the left lobe extends up to the left side, crosses the midline, and it even covers the stomach partly. So even the left lobe of the liver will be in front of the stomach. All these are the structures: anti-abdominal wall, left costal margin, left pleura and lung, diaphragm, as well as the left lobe of the liver. All the structures are in the front. Now coming to the posterior relations of the stomach, or it is also called as stomach bed. Most clearly, it will be usually it will be called as the stomach bed, okay, or the posterior relation. So bed on which the stomach will lay down. Okay, so here the stomach has been removed so that you can see the stomach bed, or on which structures it will lie. Okay, so one is the left crust of the diaphragm. If you see here, the left crust of the diaphragm, you can see this is the left crust of the diaphragm, as well as the left suprarenal gland. Here is the kidney, left kidney, and just above that is the left suprarenal gland. Left suprarenal gland as well as the left crust of the diaphragm. Both are behind the stomach, or on the stomach. Then the part of the left kidney, as you can see here, a part of the kidney can be seen. That is also there. Then we have the spleen. A large part of the spleen can be seen. So it forms the stomach bed. Then the splenic artery, as you can see here, this is the splenic artery as well as the splenic vein. Both can be seen. As well as the pancreas, as you can see here, this is a pancreas here, part of the pancreas, especially the body as well as the tail of the pancreas. Then the transverse mesocolon. If you see here, the transverse colon has been cut. Okay, so the transverse colon as well as the mesocolon, transverse mesocolon can also be seen. So here the this is the for the pylorus. Okay, this is the transverse colon. Okay, this is the transverse colon, and this is the the transverse mesocolon, which is on that. Okay, all this form the stomach bed, and even the lesser sac, the cavity behind the lesser omentum, that is called as the lesser sac. So all the structures form the stomach bed. So all the structures will be forming the stomach bed, or the posterior relation of the stomach on which the stomach will lie. Okay, so that's why it is called a stomach bed. All are separated from the stomach by the peritoneum of the lesser sac, except the spleen by the greater sac. There are two cavities. One is the lesser sac and the greater sac. All are separated by lesser sac except the spleen, which is separated by the greater sac. So here again you can see all the structures here: the left kidney, the left suprarenal gland, spleen, the pancreas, the splenic artery and the vein, transverse colon, transverse mesocolon. All these structures form the stomach bed. Now coming to the arterial supply, the blood supply of the stomach, as it is developed from the foregut. When we discuss this the development, we'll observe that the foregut, before I think I had told you that the foregut, whatever is above the second part of the duodenum, all that part is developed from the foregut. Below the second part up to the transverse colon, it is by the midgut, and below that is by the hindgut. The foregut is supplied by the artery of the foregut, that is called as the celiac trunk, celiac artery or celiac trunk. So because the stomach is also developed from the foregut, it receives the blood supply from the celiac trunk. So this celiac trunk gives three branches. So if you can see here, the one is the left gastric artery. So this is the celiac artery of the celiac trunk, which gives a branch called as the left gastric artery. This is the left gastric artery here. Okay, then the second is the hepatic artery. Here you can see here, which goes to the liver. This is called a hepatic artery. The third is the splenic artery. Here going to the spleen. This is called as the splenic artery. These are the three branches from the celiac trunk or the celiac artery: left gastric artery, splenic artery, and the hepatic artery. Okay, so all these three branches will be giving multiple branches to the stomach. So there are five arteries which are supplying the stomach from this celiac trunk. The first one is, as you already seen, the left gastric artery directly supplies the stomach in the lesser curvature. So it is a branch of the celiac artery, as you can see in this picture. This is the celiac artery, and it is giving branch. This is the left gastric artery. So it will run along the lesser curvature. As you can see here, this is the lesser curvature. It is near the lesser curvature. Okay. Then the second artery is called as the right gastric artery. Right gas. If you see here, this is the right gastric artery. Okay. This is the branch from the hepatic artery. If you see here, the celiac artery divides into hepatic artery. Hepatic artery gives a branch called as the right gastric artery. Okay. So the right gastric artery is a branch from the celiac, the hepatic branch of the celiac trunk, runs to the left along the lesser curvature. Again, this also runs along the lesser curvature. The right gastric, the left gastric as well as the right gastric both run along the lesser curvature of the stomach. So these are the two arteries, right and left gastric artery. The third artery is called a short gastric artery. There are multiple arteries, if you can see here. So this will be supplying mainly the fundus of the stomach. So these are branches from the splenic artery, which is a branch from the celiac trunk, gives splenic artery. Splenic artery gives multiple branches here. These are called as short gastric arteries. Pass in the gastrosplenic ligament and supply the fundus of the stomach. Then the fourth artery is called as the left gastroepiploic artery. Left gastroepiploic artery. You can see this is the left gastroepiploic. There is also a branch from the splenic artery. Splenic artery. Okay. Passes along the greater curvature of the stomach. Greater curvature below in the lower part in the gastrosplenic ligament. Then the fifth branch is the right gastroepiploic. This is the left gastroepiploic. This is the right gastroepiploic artery, which is a branch from the gastroduodenal artery, which is a branch from the hepatic artery. So celiac artery gives rise to hepatic artery. Hepatic artery gives rise to gastroduodenal artery. Gastroduodenal artery gives rise to the right gastroepiploic artery. So it is also coming indirectly from the celiac artery itself. So this is from the gastroduodenal artery of the hepatic artery. So these are the five branches. One is the short gastric artery. The first is the left gastric artery, right gastric artery, short gastric arteries, then the left gastroepiploic and the right gastroepiploic. These are the five branches which are supplying. So the stomach is a highly vascular organ because it has to uh, digest the food particles. So it needs lot of blood for the digestion to take place. So as I said, this gastroepiploic artery also passes along the greater curvature in the lower part. Now coming to the venous drainage of the stomach. So all of them drain into the portal circulation. All the veins which are draining the stomach will drain into a large vein called as the portal vein or into the portal circulation. So the right and left gastric artery, if you see here, there are two arteries, left gastric artery vein, the left gastric vein as well as the right gastric vein, both on the lesser curvature, directly drain into the portal vein. This is the portal large vein here. Okay. Then, so sorry, here this one. This is the portal vein. So this is the superior mesenteric vein. This is the splenic vein, joined together to form the portal vein. Superior mesenteric vein and the splenic vein joined to form the portal vein. So this is a portal vein, so into which both the right and left gastric veins will drain. Then the short gastric vein drain into the, and the left gastroepiploic veins will drain into the splenic vein. If you see here, these are the short gastric veins, and this is the left gastroepiploic vein or gastromental vein, both are same. Will drain into the splenic vein. Okay. Then we have the right gastroepiploic vein here. If you can see, this is the right gastroepiploic vein or the right gastromental vein, which will drain into the superior mesenteric vein. So it is draining into the superior mesenteric vein. Except the gases, the right gastromental or the gastroepiploic vein, all other veins, left gastroepiploic vein, the short veins, short gastric vein, left and right gastric veins, all drain into the portal vein itself. Okay. Now coming to the lymphatic drainage. Lymphatic drainage of the stomach is very important, especially in case of the carcinoma of the stomach. Carcinoma of the stomach, at that time, these lymph nodes play a very important role. Okay. So coming to the lymphatic drainage. So the lymph vessels follow the arteries. So they have the same route as that of the arteries, and they will drain into the right and left gastric nodes. If you see here, so there are gastric nodes, the left gastric node as well as the right gastric nodes. So the lesser, especially from the lesser curvature, they will drain into the left and right gastric nodes. Okay. Then right and left gastroepiploic lymph nodes. Okay, if you see here, there are the right and left gastroepiploic lymph nodes. This is the left gastroepiploic, this is the right gastroepiploic lymph nodes. And then we have the short gastric lymph nodes. Short gastric nodes. Okay. Then we have the splenic nodes. All will finally drain. Ultimately, all the lymph from the stomach will be drained into a large group of lymph nodes around the celiac artery. This is called as the celiac lymph nodes. Celiac nodes. So finally, all will drain from the short gastric node, the left gastric nodes, the right gastric nodes, short gastric nodes, left gastroepiploic lymph nodes, right gastroepiploic, splenic lymph nodes, all drain into the finally into the celiac group of lymph nodes. Okay. Now coming to the nerve supply, it is supplied by the anterior and posterior vagal trunks, which are mainly parasympathetic. The right and left vagus will supply the stomach, and out by the by that will be the parasympathetic, and there will be sympathetic nerve supply also. Okay. So if you want to disconnect the stomach of separation, then you do some surgery called as the vagotomy to cut the vagus. Okay. So there are different types of vagotomy. So that you will study when you go to the surgical cases. Okay. Coming to the development of the stomach. So the development of the stomach, if you see initially, the stomach will be also just like other parts of the tube, the intestine, like just like a tube. But then a small part dilates itself, which will be the site of the formation of the stomach. It develops from the foregut. As we know, the stomach is developing from the foregut. At first, it is simple tube which has an anterior and posterior border. Initially, there will be the two borders. This is the anterior border which you can see, and behind will be the posterior borders. And two surfaces will be there, the right as well as the left surface. This is the right surface and left surface. Anterior border, posterior border will be behind, right surface, left surface. So it has the anterior and posterior border, right and left surfaces. It is attached to the anterior and posterior abdominal wall by the ventral and dorsal mesogastrium. So it is attached, the anterior and posterior border are attached to the anterior border is attached to the ventral mesogastrium. Behind, the posterior border is attached to the dorsal mesogastrium. That is the fold of the peritoneum. Later, what happens? The posterior border develops faster than the anterior border. If you see here, now the posterior border start developing more. Actually, it will be behind. Okay. So initially there will be there will be rotation. This is called as the rotation of the intestine to 90 degrees. So the anterior border becomes the right border, and the posterior border becomes the left border. Now the left border starts increasing in size, and it keeps on going. Okay, sorry. So the posterior border, first there will be rotation of 90 degrees. Okay, so the anterior border becomes the right border and the posterior border will become the left border. Now after this rotation, the left border, as you can see here, it grows much faster than the right border. Right border will be slight growth will be there, but the left border will grow faster and becomes a dilated tube. The posterior border develops faster than the anterior border, so it gives rise to the greater curvature of the stomach. So the left border becomes larger, and then it is called as greater curvature. While its anterior border gives rise to the lesser curvature. Anterior border grows a little, so it is called as the lesser curvature. Now the stomach rotates 90 degrees to the right, as we have seen. So there will be a rotation of the stomach 90 degrees. So here will be the right surface, and this is the left surface. Now the left surface becomes anterior, and now this becomes the anterior surface instead of the right surface here. Now it becomes the anterior surface, and the right surface becomes the posterior surface. The left surface becomes anterior surface. The left surface becomes the anterior surface, and the right surface goes behind and becomes the posterior surface because of the 90-degree rotation to the right. So the greater curvature moves to the left, as you can see here. So here is the anterior border, this is the posterior border. Now it has rotated, and now it becomes the greater curvature, and it becomes the left border. The dorsal mesentery form the greater omentum. So the mesentery which is here, which is attached behind before, now it comes to the right with the rotation. So you see here there is rotation. Now this becomes the greater omentum. Okay, so this dorsal mesentery, okay, now become the greater omentum. The dorsal mesentery forms the greater omentum, and the lesser curvature moves to the right. The ventral mesentery forms the lesser omentum. So now this is the anterior of the ventral mesentery. Now it becomes goes toward the left side, and this becomes the lesser curvature, and this is called as the lesser omentum. Lesser omentum. So the ventral mesentery becomes the lesser omentum, and the dorsal mesentery becomes the greater omentum. Okay, so this is all about the development of the stomach as well as the anatomy of the stomach. So if you have any doubts regarding this, you can ask me.
Thank you, doctor.
Any questions? No questions? Just wait. Let me take your attendance. Let me take the picture, and then we can go. So till then, if you have any questions, you can ask me. No questions? Okay.
No.
Okay. Thank you very much. Thank you. If you have any questions anytime, you can ask me. Okay.